There are 5 different types of schizophrenia. Schizophrenia is a chronic, severe, debilitating mental illness characterized by disordered thoughts, abnormal behaviors, and antisocial behaviors. It is a psychotic disorder, meaning the person with schizophrenia does not identify with reality at times. Some causes of schizophrenia are genetics, the environment they live in, their brain chemistry, or if they have a history of abuse or neglect. Schizophrenia has multiple intermingled causes which may differ from person to person. Schizophrenia affects about 1.1% of the world's population. 3.5 million Americans have schizophrenia. It is also most commonly diagnosed between the ages of 16 to 25. Not only that, but it can also be hereditary. It affects men 1.5 more times than women. And schizophrenia and its treatments have caused an enormous effect on the economy. It costs around $32.5 to $65 billion each year. It also is pretty rare in young children. The National Institute of Mental Health estimates only 1 in 40,000 children experiencing the onset of schizophrenia symptoms before the age of 13. Many people with schizophrenia do not appear ill. However, many behavioral changes will cause the person to seem off as the disease progresses. Some of the symptoms include social withdrawal, anxiety, delusions, hallucinations, paranoid feelings or feelings of persecution, loss of appetite or neglecting to eat, and poor hygiene or loss of hygiene in general. Some negative symptoms disrupt normal emotions and behaviors, and they include social withdrawal, the flat affect, which is dull or monotonous speech and lack of facial expression. They have difficulty expressing emotions, lack of self-care, and inability to feel pleasure. Some cognitive symptoms may be most difficult to detect, and these include the inability to process information and make decisions, difficulty focusing or paying attention, problems with memory or learning new tasks. The diagnosis of schizophrenia is made both by ruling out other medical disorders that can cause the behavioral symptoms and by observation of the presence of characteristic symptoms of the disorder. The doctor will look for the presence of delusions, hallucinations, disorganized speech or behavior, and or negative symptoms, along with social withdrawal or dysfunction at work or in daily activities for at least 6 months. The doctor may use physical examination, psychological evaluation, laboratory testing of blood, and imaging scans to produce a complete picture of the patient's condition. Schizophrenia is a kind of psychosis, and they're usually prone to seizures. Your mind doesn't agree with reality. This alters how you think and behave. It starts around late adolescence or young adulthood. They're usually very delusional and suspicious of everyone, as if they're being watched. Serial killers such as David Berkowitz, also known as Son of Sam, had paranoid schizophrenia. Jeffrey Dahmer had borderline personality disorder. When you have the paranoid type of schizophrenia, it's the most common form. You think everyone is out to get you. For example, you think your boss is trying to hurt you by poisoning your food. The government is spying on you, and people are looking at you funny, so you think they're plotting your death or they're trying to hurt you. They aren't normally violent, but these delusions can make them feel angry, sad, or threatened. Hallucinations are also experienced. Hebephrenic schizophrenia, also known as disorganized schizophrenia, is diagnosed by inappropriate or hollow emotional responses, uncontrollable or irrational laughter, incoherent thoughts and speeches. People with this disease shouldn't drive because they can stay in the same position for hours upon end without moving. Usually diagnosed around 15 to 25 years of age, and has a poor prognosis because of the rapid development of negative symptoms and their decline in social functioning. Catatonic schizophrenia catatonia and schizophrenia can exist separately, and they're in a state where they're close to being unconscious and have a very wavy flexibility, meaning like you can just throw their body parts around and they'll be like a rag doll, and it'll just move. They're also very negative people. Not only that, but they're repetitive as well, which is why they're prone to seizures. They may say nothing for hours, or they may repeat everything you say or do. These behaviors put these people with catatonic type schizophrenia at high risk because they're often unable to take care of themselves or complete daily activities. Undifferentiated type schizophrenia. Undifferentiated type schizophrenia is a classification used when a person exhibits behaviors which fit into two or more of the other types of schizophrenia, including symptoms such as delusions, hallucinations, disorganized speech or behavior, and even catatonic behavior. Residual schizophrenia. Residual schizophrenia is when you've had a past episode of schizophrenia, and it's when the patients continue to have symptoms after the psychosis has settled, meaning like you've had schizophrenia in the past and you've had treatment, you surpassed the treatment and you're better now, but you have another episode of it and the schizophrenia still resides in your body. They still will continue to have their negative symptoms like social and emotional withdrawal, and also they will have very low energy. They won't want to do much, and sometimes they still hold their strange beliefs. These strange beliefs are the ones that are like the paranoid type schizophrenia, like you think your boss is trying to poison you or kill you, and you think that the government is watching you everywhere you are, like the birds flying around the sky. They think that they're drones reporting back to the White House and they're spies for the CIA.